Welcome to the HiFLEX Health and Performance Podcast. I'm your host, Dr. Chelsea Smith, here to guide you through all things physical therapy and whole body health. At HiFLEX, we believe the Almighty God designed us to move, heal, and thrive. Join me as we dive into pain relief, post-surgical rehab, life lessons, and key insights I share with my patients every day. Let's move better, heal stronger, and live fully. All right, welcome back to episode 7. Today I want to talk about stretching. And I feel like it is one of the most common things that I hear from a new patient. They're going to say, I know, I just need to stretch more. Or everybody tells me I just need to stretch. Or they just have this kind of assumption that that's going to be what I tell them to do. And honestly, it is one of the most infrequent things I give people on a home exercise program is stretching, interestingly enough. So I wanted to talk about that and what that really why I feel that way. So stretching in general, I'm not saying never do it. I'm not saying there's no value to it, but we are all busy people. And if I'm going to give somebody something to do for a home exercise program, I want them to have as much bang for their buck as possible. I don't want to give them something that doesn't have a lot of long-term carryover. And to me, static stretching just doesn't have a whole lot of long-term carryover for most people. Now, that depends on your goal. It depends on what your body is like. I say that as a hypermobile person, and I don't do a lot of stretching because I have a lot of range of motion, and I don't really see a point in it for myself. Even my stiff people, I would much rather someone load and lengthen while they strengthen than just sit there and hold a static stretch for, hold it for 30 seconds 3 times is some magic number that I think they just somehow tell us in PT school, and everybody comes out saying that to their patients. Hold this hamstring stretch 3 sets of 30 seconds or, 2 to 3 minutes total. And it's like, okay, but why? And is that going to carry over functionally into something? So if you don't listen to anything further in this episode, the number one takeaway is maybe you just don't need to stretch anymore. Okay, so now let's dive a little bit deeper because I do think there's value in lengthening and strengthening. I think first off, we need to cover a topic about there's really no such thing as a muscle just getting shorter outside of a case of a true contracture. If it did do that, we would see people sitting at a desk job with their elbows bent typing all day having bicep issues. And you just don't see that. You don't see bicep contractures because people sit with their elbows bent. So there's this whole different concept when it comes to hamstrings. And it's like, oh yeah, my hamstrings are just tight. Or hip flexors. Oh, I just sit all day, so therefore my hip flexors are really short. I just need to stretch them out. I think a lot of times what's happening is the body is putting tension somewhere on purpose. A lot of times it's because that area actually just needs to be strengthened. Like, yes, your hamstrings and your hip flexors are sitting in a shortened position when you're sitting down all the time. But again, they're not just shortening. Otherwise, you wouldn't be able to stand up. And maybe, in the case of people with back pain, do they stand up and can their air quote tight hip flexors pull on their low back? For sure. But again, is it because they just are short and you just need to sit there and stretch them out? Or is that a different signal that the body's giving us? So what I tend to explain to my patients is I would much rather you try to ask yourself why that tension is there and address that. And then also, if you just are really stiff and you need more range of motion, if you're going to stretch it, by golly, you better activate it there. Like, you better put that muscle to work in this new range that you're giving it, or that joint that you're giving more range of motion. You need to load it there. Otherwise, what are you doing? Like, what's the point in you just hanging out trying to get more range of motion if you're not going to use it? So in the case of hip flexors and hamstrings, I find that most often, it's a recruiting some kind of tension because it needs strength. So you can sit and you can stretch your psoas and stretch your hip flexors and smash them and do all this thing. But if you're not going to load them through a full range of motion, I don't think there's as much carryover. So just a quick example of that is I have people stand up against a door frame so that their trunk and their standing leg is as flush against that door frame as possible. And I have them just check the difference in their active range of motion and their passive range of motion. And what I mean by that is if you are envisioning this in your mind, you're flush up against the doorway and with, let's say, your right side of your body. And I'm going to ask you to march with your left leg. I want to see how high you can actively march that knee up without leaning away from the door frame, without, cheating per se. And then I want you, and maybe you just, like mark it on the wall with your hand, like hold your other hand there, or visually give yourself like, okay, that's how high I got. Then you're going to take your left arm and you're going to pull your knee up to your chest as high as you can passively get it and see if there's a difference. And there probably is. Usually people have a pretty significant difference in their active and their passive unless they've already been working on this. So I'll often have people do this, and it's like a 4 or 5 inch difference on how high they can passively pull their knee up. And then I'm like, okay, cool. Now try to hold it there when you let your arm go. And if you let go with your hand and immediately it's like, whoop, you drop 3 inches and you can't even control that end range, you probably don't have an issue with your hip flexor being, air quote, like short or tight or needing to stretch out. You probably need to learn how to control your hip through a full range of motion, through hip flexion, marching up, and all the way through extension with it behind you. So that's just one example there. If you do that, if you try that quick test of active marching and then seeing where you passively can pull your knee to, if you can't control that gap, and that's a big gap, that right there is low-hanging fruit that you can work on to address said tight hip flexors. They might just be trying to stabilize and they don't have that full capacity, full range to stabilize in, and so therefore they're just kind of hanging on to tension. And then you might go stretch it out and you feel good for 10, 15 minutes, then you go sit back down again and it's like, womp. Or you wake up the next day and it's like, oh, cool, I feel the exact same. So if you're stretching every day and you don't feel like there's carryover, just stop, stop wasting your own time. Maybe let's do something else that's a little more active. Okay, hamstrings are another thing. This is kind of interesting. If you're looking at someone's ability to do a straight leg raise, like lay on their back and keep a leg straight and just try to raise it. And then also check out if they can stand up, lean forward and touch the floor. Sometimes there's a difference there. Again, I just find that instead of just sitting there and stretching your hamstring, let's load it. Like let's do a deadlift. And you don't have to be doing some kind of crazy heavy deadlift, but if you are activating your hamstrings and lengthening them while you're loading them, oftentimes you will see a much better test and retest after, let's say, 30 reps of a load. I'll just use the cliche 3 sets of 10 or 4 sets of 6 or whatever we want to say. If you test someone's hamstring length, we'll call it, have them load through a controlled range of motion and then retest it, probably way, way better. Or if you do some nerve glides, because sometimes in the leg, it's neural tension. So without getting into the weeds and away from the just general topic of stretching, those are things that I would just have you do a test and retest. Do you have more range of motion after you load? Or do you have more range of motion after you sit and static stretch? Or do you have more range of motion after you do a sciatic nerve glide? Trial those out and see if you get better increase in range of motion after a nerve glide or after active loading. Just ditch the hamstring stretching. If you're an avid hamstring stretcher out there and you're having to do it every single day, multiple times a day to feel like you're staying stretched out, it's probably not the answer. That's just how I'm going to leave that one. So then there is the people that feel really tight because they're hypermobile. That's the category I fall into more. And again, it's to ask for stability. And if you just go stretch that out, it's going to put it back in. So my biggest take home for you guys is try and ditch the static stretching if it's not solving any problems for you. If you love it and you feel great, by all means, keep static stretching. But if you are coming to me and you're like, oh, no, I should stretch more, like you don't even have to feel so downtrodden about it. Like maybe not. I'm probably not going to tell you to stretch, actually. Find what your range of motion looks like and activate through it. So another thing, I think a good test is, let's say, shoulder range of motion. If you're trying to increase your shoulder range of motion passively, like you're just stretching your pecs or you're just stretching into overhead, try to activate there. Do you have any strength up there? Like, have you ever actually just activated through that full range of motion? If you haven't, I would start there. So if you're going to stretch there, I want you to own there. Don't just passively move to an end range and then leave it at that. If you're going to stretch yourself to a new range of motion, activate there. Okay? Write that down. Take it home. If you're going to stretch there, you may as well own it there. Sometimes I'll talk about it as play. Like if you're going to play there, own it. If you're going to mess around with, I just want to be able to move farther, cool, just own it. Otherwise, you're wasting your own time. Another thing that I think is valuable that I've really been in my own movement patterns trying to embrace is in the same vein of activating and owning. When it comes to squats is one that I've really been working on. Squat depth. So I always kind of struggled with pinching in the front of my hips. And I just couldn't figure out how to comfortably get into a deeper squat. And it wasn't really until my friend Jackie, who's also a DPT, I think she's the first person that really pointed out to me was shin strength, like my dorsiflexion, the ability for the front of my shin muscle, your anterior tib, to pull your leg forward and actually like assist pulling you into that squat movement. And it was mind blowing. I was like, I have no strength here. Holy moly. So just viewing it as, yes, you are sitting down into a squat, and I'm just going to use a squat as an example right now because it's a very functional movement pattern that everybody has to do. You're not just letting gravity pull you there. You have opposite muscles that are assisting and controlling you to get there, and that are not, they don't need to just be off, flaccid, like doing nothing for you. So if you are working on your squatting, take a look at your shin strength. Sit in a doorway, sit all the way as far as you can into a deep squat, and let yourself lean back so you don't feel like you're going to, pinch the front of your hip. But hold on to the doorway and let yourself lean back, because otherwise you'd fall backwards on your butt. And explore what it feels like to pull your body forward with your shin muscle. It's just, it's crazy once you realize how much strength a lot of people don't have there. And it opens up so much range. Once you have that ankle dorsiflexion and once you have the hip mobility, all of a sudden your squats, it's like, whoa, okay. And none of that is with stretching, I guess is what I'm getting at. The other big hip opener that I love for squatting that also doesn't involve stretching the front of my hip or stretching anything, my hip flexors or my hamstrings, is activating my glutes in a squat position. So I will get in, not a full squat, in a half squat, we'll call it, aka a lunge. So I'll be in a lunge where my right leg, if we're using that as the example side, is angled out to the side. And as I am shifting my body weight over that leg, I am driving my knee back to the side to try and activate my glutes and just open up my hip. So by activating the back of my hip, it's opening up the front of my hip. So this whole concept of opposite muscle groups, there's all different fancy words we can use for that in the physical therapy world, like reciprocal inhibition and whatever. But if something is tight, try activating the opposite muscle group and see if that thing loosens up. For me, if the front of my hip is tight and I activate my glute and I'm really working on opening my hip, driving my knee out as I'm kind of doing a lateral lunge, I go back to my squat position, so much more freedom of movement in the front of my hip. So, okay, I'm going to try and keep this one under 15 minutes, and right now we're coming up to the 13-minute mark, so I'm going to start wrapping it up here. But takeaway points. If you're going to play there, own there. If something is tight, try activating the opposite muscle group. Try a nerve glide. Try just activating through full range of motion, whatever that looks like, and see how you do. So here's just me, a physical therapist out here telling you, maybe don't waste your time stretching. Maybe try something else. I'd rather you do 3 awesome functional-based movement patterns where you are really focusing on control and a couple nerve glides than I ever want to waste your time just sitting there doing 3 sets of 30 seconds. So if this is what you needed to hear because you're tired of stretching, or if you're tired of just guilting yourself saying, oh, I just need to stretch, take that load off. Probably don't need to stretch. Let's activate. Let's own it. All right. Have a good one. Thank you for tuning in to the HiFLEX Health and Performance Podcast. I hope you enjoyed this episode and learned something new to help you move, heal, and thrive. If you'd like to dive deeper into any of these topics, feel free to reach out to me directly at chelsea@hiflexhealth.com. Visit our website at www.hiflexhealth.com or connect with us on social media. Keep learning, keep moving, and keep healing. And I look forward to having you back for the next episode.